right. Hello, everyone. I have a wonderful patient of mine all the way from Alaska. Question for you. How are you feeling this morning, a few days after your surgery?
I'm feeling very comfortable. I'm really surprised by the minimal amount of pain that I have. It was actually more painful to have the implants in than post-operatively. I'm moving around fine and able to get rest. And yeah, I'm very surprised by how comfortable I am.
Yes, you had implants, just one set, 2009 silicone, what is below the muscle, and 600 cc's each. Now, your implants were 15 years old. The right one was ruptured, the left one was intact, and I have to say, you easily are in the top 5 most involved explants that I've done this year, just given the amount of inflammation that was present on the right side. Now, how do you feel now compared to where you were before surgery?
I do feel like I am in a completely different body. I had almost every symptom of breast implant illness. However, like all of your patients are aware, it's really hard to pinpoint that to breast implant illness because it could be so many other things. But immediately post-op, I was surprised that I no longer had like a lump in my throat. I felt like every time I swallowed, there was this nasty big phlegm that I had to swallow around. That was gone. My sinuses are clear. The other really crazy thing is that my eyes were almost starting to cross because I've been taking pictures of my face in direct daylight every morning, morning of surgery and then every day post-op. And yeah, my left eye was starting to almost cross, and now my eyes are straighter. The whites of my eyes are brighter. And actually last night I was reading my Kindle and I noticed that my vision is improved. I can hold my Kindle back further than I'm able to, so even my vision's improving. When I walk, because I've been taking about a 30-minute walk every day, I have a spring in my step that I did not have. I feel lighter, and it's not, I don't mean lighter like I just lost 1,200 cc's of implants. I just mean my body, my joints are lighter. I don't have back pain for the first time in, I can't remember when. What else? My mental clarity. I also don't feel anxious. I was struggling with anxiety. I had postpartum anxiety that I thought, I was still suffering from because I was still nursing my baby. But I don't feel anxious at all, even though I just had a very major surgery. So I'm sure that there's more, but those are the ones that really
Sure.
come.
Now, we want you to basically tell us in a month, 3 months, 6 months how you are, because you showed me that, and I remember looking at your pre-op very clearly, your face before and after, and we will see how your body is going to declare itself. Other people are going to recognize your face, your skin, your personality, as far as the anxiety and like the mood swings, again, whatever you had. And we have, you're just 2 days out from your surgery.
Right.
Correct. Yeah. Now we will see, and we will hear from you. The heal is real. Now, the most important question, because you're a CRNA, you work in the operating room every day. How is your anesthesia experience?
My anesthesia experience was fantastic. I just got what you describe as twilight. I remember meeting my CRNA, talking to her. She was very kind. She made me feel very comfortable right away. I remember walking into the operating room and lying down on the table, and then you said, "Have a nice nap," and that's literally all I remember. And then in recovery room, the nurse was like, "Well, it's time to go," and I'm like, "Well, I need to put my pants on," and like I had already been dressed, and I don't remember any of that. I was very, very, very comfortable.
Right. And this is what I say. There are the two major, general and twilight. This is very safe, very effective,
Yeah.
gets the job done. You recover optimally, minimal post-op side effects. And this is a surgery where truly twilight, deep sedation is the way to go. Not a single patient to date has had any recollection. Now,
it was over 5 hours,
Yeah,
right?
yeah,
And
yeah,
I had no nausea, no vomiting, nothing.
Yeah, and this is where we can, and certainly this anesthesia can be done safely for this extended period of time, very definitively, comfortably, without any risks, compared to general where you have to put the tube and have the ventilator breathe, which is still safe, but this is safer.
Yeah.
Now, what would you say to that someone or some group or to the other doctors who say, well, this is all like the pain medication Percocet you're on, or the pure Michigan air, or this is all in your head, a placebo effect?
I would say there's too many of us now. You can't, I mean, you can put your head in the sand if you'd like. It's not doing your due diligence as a provider. It violates your Hippocratic Oath, and there's too many women that are saying the exact same thing that I don't know. I'm not talking to them. It's not a conspiracy that we're all in on. The symptoms are too consistent and too frequently reported. Just because there's no definitive research that is controlled doesn't mean that it's not real. Anecdotal research is just as real. I would challenge you that if you do think that breast implant illness is a myth or that we're crazy, that we have a conversation face to face, because I'd like to hear how you could justify that whenever so many women have the same complaints and they have the same experience as soon as they're out. I don't know how my vision and my eye shape and the way that my vision has changed could, if it's not real, how could it change so quickly? I mean, I'm just excited to see my changes further out I get, because I've already seen dramatic results.
No, very well said. And I'll end with this. The implants were banned for a reason, and this is the same reason why they need to be banned again. And also, the other thing here is the way your right implant ruptured, and you'll see that in the video, that is in the same way, shape, form it ruptured before, in like the 80s when you had those non-gummy bear implants. So this gummy bear, supposedly safe, better implant, ruptured in the same manner that all those previous implants ruptured that led to the ban. And this will inevitably come. And no, again, thank you very much for sharing your journey. The heal is real. And again, you are one more added force to see and realize. And we want to hear from you. We want to continue to hear from you so that we basically only reaffirm the obvious. Implants are not worth it. They harm the body and they are not worth the hurt.
I agree.
Thank you.
Yeah.